Good morning, good afternoon. Thank you very much for having me here. Being based in Warsaw, I very much regret we cannot meet in person in my hometown as it was planned. But at the same time, I'm glad the organizers decided to host an online event and focus our attention for a while on urban public health policies. COVID pandemic is actually reminding us once again about the principle to think globally but act locally. It applies to drug policy, which is my field of work. And when we look at the countries that are rightfully praised for their drug policies, like Portugal for decriminalizing drug possession, or Switzerland for providing very wide access to drug treatment and harm reduction services, we seldom realize, or we don't remember, the reforms started at the local level with courageous and dedicated physicians, NGOs, mobilized local communities. In Portugal, before the government established in 1998 a group of experts who prepared the basis for the national reform, already in the early 1990s, small teams of street workers, needle and syringe exchange programs, and low threshold methadone programs started to operate in Lisbon, in the district of Casal Ventoso, known for the widespread presence of drugs. In Copenhagen, in Denmark, the Street Lawyers Organization that many of us know quite well, for a long time advocated for opening a consumption room with no result. So after conducting a detailed legal analysis that proved that there would be no violation of the law, a project of mobile injection room was started without waiting for the green light from the authorities. So what could the authorities do? They created the legal framework which allowed for opening injection facilities, including age 17, the biggest one in the world, at least at that time. A bit more recent example comes from Eastern Europe, from the city of Sumy in Ukraine, where a safe consumption room was opened last year with municipal support, hopefully paving the way for similar initiatives in the region, since this is the very first drug consumption facility in Eastern Europe and Central Asia. Most of these, but also some other examples, have been covered by the Lessons for Drug Policy series published by the Open Society Foundations. So I really encourage you to check our SEF webpage and dig a bit more into the history of these pragmatic and compassionate drug policy reforms. What I myself found interesting was that severe public health crisis years ago was quite often the beginning, the reason behind many of these successful stories. In Portugal, a Eurobarometer survey conducted in 1997 showed that drug-related issues were perceived as the country's main social problem. But the first state responses to these critical situations were usually completely counterproductive. That is, intensifying repressive measures. Even in Switzerland, the abstinence-oriented drug law introduced back in the 1970s not only defined rigorous criminal sanctions, but it also prohibited the provision of sterile needles and syringes. So before the states did the right things, these were the local decision makers, local medical staff, local social workers, police officers who had to deal with the problems on the streets, in their districts, the problems, but also the tragedies they could see. And they were the ones who could not afford waiting endlessly for wiser solutions from the state level. Therefore, they created their own. In Zurich, in Switzerland, 300 physicians risked losing their medical licenses, but they decided to still distribute injection equipment to people visiting the so-called needle park, the place where even up to 1,000 drug users would gather every day. And in a way, we can observe a somewhat similar situation nowadays with the pandemic, when in many places, these are the local clinics, local hospitals, social workers, outreach teams, local communities and their allies who are at the front line of the fight with the pandemic, but also they are the ones to respond to the needs of the most vulnerable groups. And actually, they are the ones who immediately started to think outside of the box. Harm reduction services today very often provide not only needles and syringes, but they also distribute food, drinking water, hygiene products for women. In many places, in order to meet their clients, harm reduction workers decided not only to go outside to do the outreach work, but they're also right now buying vans to start the mobile units, or they are opening their services outside of the buildings in tents. A UK-based NGO release prepared very interesting cards called Essential Journey Cards for clients of harm reduction services and drug treatment units. So when they need to leave home, they can take the card with them, and when stopped by the police, they're somewhat safe, and their presence outside of the buildings is justified even at the time of the lockdown. The card simply says they have to go to pick up their medication or harm reduction equipment. I was also really encouraged to hear from the drug reporter that the city of Barcelona opened shelters for homeless people who use drugs. Therefore, they are denied access to other shelters. So right now, thanks to the city, there are 70 places available for men and women who live with alcohol or other dependencies. In many places, OST programs nowadays are allowing for bigger substitution take-home doses, something that has been denied for quite a long time. And even in the drug policy spheres that do require mainly state-level reforms, I'm thinking about decarceration, decriminalization. Even in these spheres, some improvements can be achieved at the local level, at least to improve incarceration conditions, for example. A human rights association, Antigona, that focuses on the penal system and closely monitors the situation in prisons in Italy, recommended that each penitentiary facility should purchase smartphones and prepaid cards to allow prisoners for regular daily phone or video calls with their relatives, with their families during the COVID pandemic. Let me show also a very welcome novelty that we can observe at the streets of Poland nowadays, that is deprioritization of the non-violent drug offenses by the police. When the police became occupied with other tasks linked to the lockdown rules, they simply resigned from stopping people to check their pockets for drugs, something that activists and advocates here in Poland have been advocating for years. So right now is the time for NGOs to monitor the situation, to collect data, to closely observe what is happening on the streets, to build a strong argument for decriminalization for the post-COVID times. I actually wished to stop here after sharing these encouraging examples that are coming from cities all over Europe, and they can show that actually cities can be incubators for very good practices. But there is also the other side of the coin. COVID pandemic has created some space and definitely a need for creativity and innovation, as crises do. But it is mainly posing threats. In addition to the public health, social, economic ones, in some places it has intensified populist and authoritarian tendencies. I'm thinking mainly, but not exclusively, about Central and Eastern Europe, about my home country, Poland, about Hungary, Bulgaria, Russia. The pandemic provided a pretext for the authorities to impose restrictions, resulting in the space for civil society severely shrinking or even closing. NGOs, in particular these that are perceived as critical to the authorities, these that work in the areas treated as controversial or morally dubious, HIV/AIDS, harm reduction, drug policy, sex work, LGBTQ communities, women's rights, etc., etc., they have already been targeted with the legal changes or smear campaigns. We could see a lot of that happening in Hungary, for example. When austerity measures were to be put in place, and actually we can expect more of them to come, these NGOs were the first ones to experience financial cuts or even to become ineligible for funds distributed by the state, regional, or municipal administration. In some cases, they had to close down, as it happened with harm reduction providers in Budapest. These are the organizations, the groups, the communities that have been investigated by the police, as it happened to the Center of Women's Rights in Poland, or by the governmental audit offices, by prosecutors' offices. We've seen tons of such cases in Hungary. Also, they have been attacked vocally, for example, in the media, by the media, but also personally, physically. Their offices, staff members, or volunteers have faced attacks. And right now, they're also punished for providing information around COVID, around the pandemic, and the safety measures. Unfortunately, I'm afraid we can expect even more of this to come. Therefore, to summarize and to come to an end, I would like to stress that I believe cities can serve as incubators of good practices. They did in the past, they're doing so now. But to use the potential that exists at the municipal level, we need all actors of the city level work to be included in that process, to be given a chance. And for that reason, they simply need to exist, to be safe, be adequately funded, and be listened to. Today, we need to remember about solidarity internationally in the whole sector, about the need to build very broad human rights coalitions. We have to educate and inform so the society understands that accessible harm reduction, wise drug policy, strong communities are now even more important, even more needed than ever. And to close, let me also say that I've shared some of the European examples simply because this is where I live, where I work, and when I can observe quite closely, on one hand, pragmatic solutions and compassionate attitudes, and on the other one, the closing space for civil society and austerity measures driven by populism and authoritarianism. But of course, lessons can be learned from other regions as well. I look at the encouraging stories of community mobilization or broad cooperations that come from Latin America, for example. So let's look around for inspirations. Thank you for your attention. Stay safe, stay at home if you need and if you can. But let's make sure, as someone said, let's not allow the revolution to be quarantined. Thank you.